My name is Chris Roth. I am a neuroradiologist and I serve as the Vice Chairman for IT and Informatics here at Duke Health. A neuroradiologist is a physician who looks at images, CT, MRI images of the brain, the spine, the head and neck, the eyes, the aerodigestive tract, and diagnoses the problems that they may be arriving at Duke for. What makes Duke unique is that we have not just some of the best physicians that are here, but we have some of the best technology. And when I say technology, I'm referring to medical imaging technology. I'm referring to information technology around your patient records. And most sites across the country have not put the amount of time and effort and resources into the system that we have to work from here. In many cases, we're actually bringing in images from the outside as well, and we're leading the initiative in North Carolina to put everybody on the same image sharing platform, so that if you have imaging that gets done closer to your home or at another center here in North Carolina, we can very quickly get those into Duke so that everybody here knows what's happened to you before you got here as well. The one thing I would want patients to know about how I practice is every single day I come into work and try to ask myself the question of what would I want if I was the patient? What would I want if I was the patient that I was looking at in the reading room, if I'm looking at their CT or MRI? What would I want if I was a patient who needed to get images into Duke? What would I want if I had to get access to an imaging department? I think those are things that often get lost in the medical world today when we're focusing on a lot of administrative things that don't quite matter as much. And I think if everybody were to pay attention a little bit more to, okay, I'm now the patient and at some point I will be, like all of us will be, what do I want? And let's go try to make that happen.